Start. Good morning to Mr. Azman Mustafa from PK Coaching, right?
Yep.
So today we are going to do an interview about um, children with special needs, um, especially children with autism. So I will start with the first question, and it is, why does children with special needs, such as autism, are often neglected from their academics?
All right. Okay. Uh, Good morning. Any of you Muslim here?
Yes.
Good morning and Assalamualaikum. All right. You guys only speak English, no Malay.
Boleh, ya, boleh.
Boleh.
Okay. All right. Uh, First of all, children, special need children, especially autism in Malaysia, they are never being neglected. Okay, they are never being neglected. The problem is in Malaysia now, the facilities that we are having now terlalu sikit. That's the problem. Okay, so change the question actually. So for example, in Malaysia we have a very little therapy center. But kalau ada, alright, kalau ada, it is so expensive. So a lot of parents with children yang ada autism ni, they are not well off. Okay, they are all middle income or low income, right? Some parents they had to go for zakat to get money from zakat to go for the therapy. So because therapy is not cheap. Okay, for example, for one session of therapy is 150 ringgit average. Okay, average, and can go as high as 200 ringgit or 250 ringgit per session. Per session is 1 hour. So imagine if you go for every day, how much you pay for 1 month? You can count yourself, right? So let's say
Yes,
200 per session. You go for every day, it's already 6,000. So 6,000, you can pay houses, you can pay for your buy for food, for your many things, right? Just for the session. Okay, and number two, we have in Malaysia, we have special need class, special class. It's called PPKI. PPKI stands for Program Pendidikan Khas Integrasi. Not all school have PPKI. Sepatutnya at this time, schools in Malaysia should have one PPKI, but not all schools have PPKI. So the problem is, in one class will accommodate 20 to 30, not only autism. It can be Down syndrome. Okay, have you ever heard of Down syndrome?
yes.
Okay, have you ever heard of ADHD? Yes.
Yes.
Have you ever heard of cerebral palsy?
No.
Yes.
Okay, have you ever heard of okay lah, these are the common conditions, these 5 common conditions. So when they are put inside in one class for 20 to 30 people, the problem is lack of teachers. So teachers can be 2 or 3 teachers. How can 3 teachers facing how can they teach these 30 children? That's the problem. Boleh faham? So it's not, the children are not being neglected. It is the school are being neglected by the government. Boleh faham? So the government doesn't do their work. Boleh faham?
Kan.
Boleh faham? Okay. They are not being neglected. They are never being neglected. All right. And now the rise of autism is very sharp. It's like this. Okay. It's like this. Now it's about 60,000 autistic children in Malaysia. 60,000. That's a lot. Okay. That's a very, very, very high number. Very big amount. So I hope I have answered the first question. What is your second question? Or do you
that's
have
it.
any question regarding the first question?
Has anyone any question?
Can I try?
Okay.
Oh, sure.
I wanna ask, uh, is it important for us to talk openly about the autism with the children and how the parents or the teacher can do this effectively?
I don't understand your question.
Uh, I wanna repeat that again.
What do you mean how
Is
to
it
talk
important?
properly? What do you mean by
Huh?
how to talk properly? What do you mean by that? How to talk properly with teachers? What do you mean by that?
He said
Uh, is it important for us to talk openly about the autism with the children and how the parents or the teacher can do this effectively? That's my answer. That's my question.
Okay. It is important. You mean to spread awareness?
Yes. Is
Okay.
it?
Okay. For you to spread awareness about autism, you must know about autism. If you don't know
Uh,
about autism, don't talk about autism. Because
mm,
autism, the subject about autism, the topic about autism is very, very, very wide. You need to
uh,
know about autism. Okay, so if you want to know about autism, okay, it's like what we are doing now. Boleh faham? But if
okay.
you openly want to spread awareness and you know nothing about autism, okay, all right, and then suddenly a father or a mother asks you about autism and you blur. What is that? So spreading awareness, if you want to spread awareness about autism, you have to have knowledge about autism. Or ADHD ke, or anything lah. Macam tu lah. Okay. So it is important to spread awareness. Yes, memang. Awareness is one of the key thing to make sure that why awareness is very important is so that the parents, okay, especially the parents, when they see their children at the age starting from 2, when they have given awareness about autism, then they can detect the symptom of autism. So my child has this problem, so I have to see doctor. So kalau tak ada awareness tu, alright, if they don't have this knowledge about autism, the parents will let their anak membesar macam tu. Biar sampai 4-5 tahun. So in the end, it's too late already to do therapy because therapy has to be started at the age of 2. Okay, 2 until sampai besar. Alright, any question? Any question?
Can I ask the next question, sir?
Okay. Is that photo or your picture? Okay.
Sorry,
Right.
sorry.
Okay.
Okay, first I wanted to ask, what is one big problem
Mhm.
children with autism face?
Oh, there is a very, if you see one problem is not a appropriate question. There is no one problem. There are many problems. Okay. Which is social, interaction, behavior, speech and language. 5. Cognitive. 6. These are the big problem. Not only one problem. Okay. So have I answered your question? Any question regarding your question?
No. No.
Okay. Who's the next one?
so. My next question is,
Mm-hmm.
so I have a cousin with autism also, and often
Who?
I have a cousin with autism, and
How old?
sometimes um uh, oh, 5 or 6 or 7, not sure. And
Okay.
then sometimes when he is acting up in the public, people always like make faces that like macam muka masam gitu.
Sinis. Muka
Uh,
sinis.
yes.
Okay. All
So
right.
to
All right.
us,
Right. If I was there,
huh?
all right,
Yeah.
during that incident, if I was there and I have a son with autism, I takkan bagi muka sinis
Hmm.
ataupun bagi muka pelik lah, strange face lah, betul tak?
Hmm.
Right. So, if public yang lain tak tahu autism, tak tahu ADHD, they know nothing about that, and they also have children, normal children, of course they orang akan bagi muka pelik, and of course they will think that apalah bapak ni, mak ni tak pandai jaga anak,
Hmm.
apalah mak bapak ni tak pandai ajar anak. So that is why earlier before, awareness is very important. It's not only awareness to parents yang ada anak autism, awareness to public. Okay, like we are
Yes.
doing now. I'm giving awareness to you all. So when I'm giving awareness to you all, you get the knowledge, you get the info, and you pass it to other people. Okay, boleh faham?
Wow.
So you cannot blame the public giving that kind of face to budak-budak yang hyperactive, aggressive, kan, in the public. You cannot blame them. So the only way is, I always tell the parents, as a consultant lah, I always tell the parents, jangan peduli. Number two, jangan bawa anak keluar lah. Kalau jangan bawa anak keluar to a place where there's a lot of public. Pergilah ke tempat yang aman, yang quiet place for just for among the family itu saja. Right? Okay? And of course, bila parents yang ada anak agresif macam ni, buat perangai pelik dalam public, of course dia akan rasa malu. Correct or not?
Right.
So, tapi masalahnya parents yang ada anak autism ni masih juga nak bawa ke public. Sebab boring kat rumah. Bila boring kat rumah, mesti nak keluar. Betul tak? Can you stay at home 24/7? Can you? Cannot. Right. Okay. So any question regarding your question?
About the question just now, apa steps yang NGO kamu ambil untuk like spread awareness?
Yeah.
What's the steps taken by your NGO to spread awareness?
What is my step to spread awareness? Dia macam ni. I have a group called Reality Autism in Facebook. Reality Autism in Facebook. You can look it up. Okay, now I have 61,000 members already. 61,000 followers already. So in all this group, in this group, not only parents, they are doctors, they are therapists, they are teachers. Okay. So when these people join this group, in my group, this group, so I give them about, talk to them about autism. Not only me, other parents also cerita-cerita lah. They post, comment. And these people will tell other people. Faham tak? So 60,000 people, okay, each people can spread awareness about autism to 2 other people. So how many ada? 120,000. Macam itulah. That is why Facebook group that I created is very important. Very, very important to spread awareness. Okay. So NGO for us, Peka, is just to let you know, Peka, dia ada members, right? In Peka, semua ada anak autism. Semua ada. All are grown up. All are over 12 years old. We've known each other for the last 10 years. Okay, we've known each other for the last 10 years. So, right now, yang dalam grup saya ni, dalam grup Facebook tu, semua anak-anak kecil. Okay, anak kecil, below 7 years old lah. Yang ni lah perlu kena brainwash. These parents has to be brainwashed. Okay, how to handle anak, how to train anak. dalam masa golden age. Golden age maksudnya between 2 years old to 6 years old. So that anak boleh progress, so that anak boleh sekolah nanti. Okay. Oh, my main purpose, main key or main focus, even though autism is very big, the topic is very big, but I have only focus one thing, pengurusan diri, living skill. Okay, living skill, meaning they have to train untuk free diaper and toilet train, these two. Yang ni selalu anak-anak autism gagal, selalu gagal. Bukan salah anak, salah mak bapak. So my job to spread awareness to parents yang ada anak autism. Okay, boleh faham tak?
Faham.
Even though the awareness ni sedar daripada apa? Okay, let me ask you apa GRL. Okay, let me ask you GRL. What do you know? What do you understand about awareness?
It's about knowing something,
Okay, knowing something.
paying attention to it.
Okay, what about others? The rest?
We know about that.
Okay, the two girls.
Um,
Where are the two girls just now?
I have question.
No. I ask question first. Then I tell you. What do you know? What do you understand about awareness? Hello, cannot hear you.
your mic, Rabiatul, your mic.
My mic.
No, Rabiatul mic.
Okay. Alright. Siapa yang nak tanya
Sekejap,
saya tadi?
I think she has a bad network.
Okay, it's okay. Okay, next question. Okay, sebelum tu. Awareness is okay to know something that you don't know lah. Betul tak?
Yeah.
Okay. My focus is to know something that you know and to repetitively to let you know that you know already. Boleh faham?
Yeah.
So you have to tell constantly the same thing. That is awareness. Okay? Awareness kalau cakap sekali aja semua lupa. But you have to be repetitively. Okay? Alright.
I wanna ask. Is it hard to us for teaching the children like this? And did you have some of the other ways that we can approach them and teaching them effectively?
Okay. For you, okay, there are two. For me, as a parent, okay, as a parent, I have to teach anak whether you like it or not. Correct or not?
Yes.
So whether you like it or not, you have to do a lot of reading. That's one thing. Reading maksudnya you have to know knowledge about autism. You have to know specifically what is the problem with your son, my son lah. Okay. So as a parent, you cannot escape. You tak boleh kata, I don't want to know about my child lah. Don't want to, tak dapat. Because itu anak, right? For you, kalau tak ada anak autism, you have to go for the course lah. You have to go to the course. You have to take a course. You have to take a diploma or degree to learn about this special need. Like a speech therapist, to become a speech therapist, to become a occupational therapist. I don't know dekat MSU ada tak that course or not, right? So in order for you to teach them, to train them, you have this course lah, and then you have clinical time. I mean macam amali, macam Yalah, macam Emily experiment with the kids with autism lah. Yes, you can. But the problem now, ini lupa saya cakap. But the problem now in Malaysia, teachers in a special needs school, okay, which I mentioned earlier is PPKI, they don't have this background. They don't have this background. Background teacher like you, TESOL lah, engineering lah, apa-apa lah. Boleh jadi cikgu. But they don't have this background. So when the kids come to school, they blur. Apa nak buat? Apa nak buat? Boleh faham? Okay. So to deal with these special need children, not only autism, you have to have knowledge. No matter what, you have to have knowledge. And you have to have knowledge and you put in practical. Boleh faham? Any question regarding your question?
Can I ask?
Cannot hear.
Um,
It's lagging, sir.
Lagging. Boleh turn off the Zoom and then you turn balik on. Any question?
Yes, sir. Can I ask?
Ya. Boleh?
Okay.
Siapa cakap tak boleh?
Okay. What is the hardest part about helping people understand autism?
What is the hardest part for other people to understand autism?
Yeah,
Okay.
about helping people understand autism.
Okay. To my experience, even though I give talk many times already. Okay, many times already. If you ask me what is the hardest part to give awareness to other people, you mean public lah, not parents with autism, correct?
Yeah,
You mean
correct.
public.
Public.
All right.
Yes.
So the hardest part for them, for me, is they will never understand. Even though I say for 1 hour or 2 hours or 3 hours, they will never understand. But they know. Boleh faham? I give you example lah. Okay, I give you example. Your name is Shimiga, right? Shimiga.
Yeah, Shemiga.
Okay, Shimiga. Okay, Shimiga. You punya kereta buka hood, you buka tudung radiator, buka ini, buka skru. Tahu tak? Tahu. Bila you buka hood, you boleh buat tidak? Tak boleh kan? Okay. Itu problemnya masyarakat. Like I said earlier, yang cakap dekat public tu, public cakap bagi muka strange face lah. Apalah parents ni tak pandai jaga anak. Because they don't understand. Because they don't have anak special. Boleh
Oh,
faham? So the only way, okay, untuk bagi tahu public, like you people, of course you understand, I understand, but you never feel it. You never experience it. Boleh faham? Even though Siadel, apa nama, dia ada cousin, umur 7 tahun. Dia tidak pernah merasa susah. Dia tidak pernah tidur sama dengan cousin. Dia tidak pernah bagi makan dengan cousin. Dia tidak tidur sebumbung under the same roof with that
Actually,
cousin.
pernah sih,
So
tapi
he will not
pernah
understand.
menang.
Alright, he will not understand. So that is the hardest part lah, to make public understand. But we keep continuing to give the same information so that one day, bukan kita nak minta lah, ditakdirkan Tuhan dia ada anak autism, at least dia dah tahu, dia pernah dengar hal autism. Itu sebenarnya. Boleh faham?
okay.
So if I tell you even though I tell you about 3 hours, you cannot feel me.
I
How
get
I
it.
raise my children, how I train my children, you cannot feel me. No way you can feel me. Boleh faham?
Understand.
Okay. What's your next question?
Does anybody have questions?
Uh, we have 5 minutes remaining on the meeting, so I think Rabiatul, can you ask the last question? As a closing lah.
Boleh dengar? Boleh dengar tak?
Boleh boleh.
Boleh.
What advice would you give to someone who wants to become an advocate for autism awareness but doesn't know where to start?
Oh, doesn't know how to start. Senang je, cari
Ya.
ilmu. Cari ilmu. Lot of reading. A lot of reading. Okay. You apa nama?
Betul.
Okay. What course are you taking now?
Early childhood education.
Okay. Tell me honestly, do you have passion on what you're doing now? Tell me honestly.
What?
Don't lie to me, Do you have passion? Passion, bukan ION. Passion. Apa nama? Kesukaan. Passion. Do you have passion on the course on you're taking now? Tell me honestly.
Um,
Don't lie.
sikit.
Sikit. You know, if you want to apa nama, you punya friend, kawan-kawan you, tutup mulut, jangan bagi tahu orang lain, dia tak ada passion, passion dia sikit saja. Okay, you take this course because dua sebab, tiga sebab. Satu, mak bapak suruh. Dua, you punya score, you punya kredit ke apa, tak cukup ambil course lain, so you have to take this course. Tiga, you have no choice. Okay, tiga, you have no choice. So, if you want to really get a good advocate or good consultant, you have to have passion. When you have passion, you mesti rajin cari ilmu. Not only this, what you're learning now, mesti cari ilmu dekat luar. Cari ilmu ni macam mana? You berjumpa orang yang ada anak autism, discuss dengan dia orang, bercakap dengan dia orang, talk to them. To be an advocate, you have to listen. You have to listen. And then you grab all the knowledge. If you don't have passion, sorry to tell you, after you graduate, you nak kerja pun susah. Okay? You nak kerja pun susah. So, I'm not blaming you. Okay, I pernah bagi talk with the students like you. Okay, ada 10 orang. I tanya 10 orang tu, seorang je yang ada passion. 9 tu semua sebab lain. Tapi I cakap, no matter what, you have to pass. You have to have passion. Then you can become advocate. Okay, this is your extra info. Special need children, dekat therapy center, yang bekerja di therapy center tu, every month, bila dah masuk, after 1 month, dia quit. Because apa? Dia tak tahan. That's the reason why is dia tak ada love for the children. Dia tak ada love apa yang dia buat. You have to have passion. Okay? For you, not for you only, I'm telling you, not only you, the rest of you. Whatever you do, you have to have passion. Then you can succeed. Boleh? Any question? You have any question?
I think anyone has question?
No. For me, no.
Yeah, for me also I'm done.
Yeah, that's all from us. So thank you so much, Mr. Azman from PK Kucing. We really
Yeah.
do enjoy, and we have learned a lot today in these past how many minutes just now? 20 something, maybe.
Okay. So short,
Yeah.
And we really appreciate your time, sir.
Thank you, sir.
Okay. Actually, I'm not in Kuching.
Oh yeah.
I'm in US.
Oh.
Oh.
Okay. I'll be coming back to Kuching on the 22nd January pula, June this year. Next month lah. Okay. So if you guys want to meet me, minum kopi pun boleh, give me a call. Alright?
Well, listen. Thank you so
Thank you,
much,
sir.
Especially
Thank you,
this
sir.
one, the one yang ambil special need ni. The siapa nama dia tadi? Especially that one. Yang ambil special need tadi.
Abiatur.
Kalau dia berani jumpa saya lah.